Yes, can you go back one slide? Thank you. All right, good morning, everyone. Now we are trying to get started here. I think everybody from India is quite late evening time, and thanks again for joining us. And those of us in the United States, Pacific Coast is early morning, so I again want to welcome everybody to our first LASI-DAD webinar. So today we like to introduce our Wave 2 LASI-DAD project. India PI, Dr. Shamisa Day, will give us an overview of the project, followed by Ms. Sandy Chen, our LASI-DAD data director, will introduce the details about how you can download the data and analyze the data utilizing some of the variables that we have constructed. Our colleague, Dr. Arden Gross, has constructed some of the latent cognition variables, so she can touch on that. And our team has worked hard on actually putting the data together to make a national representative study. So we will also introduce how you can use our sampling ways to analyze the data and making an inferences at the national level. It is unusual time among the scientists who's working on global health. So I'm really delighted that we are still able to get together here and share our accomplishments during the last 4 years in working together on getting this data together and analyzing them together. So with that overview, I'd like to invite Dr. Shamisa to give us an overview of the project.
Thank you, Professor Jinko. Good morning and good evening to everyone. So I'll give the overview of our LASI-DAD project. So this wave 1 of the LASI-DAD was started in 2017 up to 2020. The responders were recruited from the LASI of over age 60 plus from 18 states and union territories of India. And that responders were follow-up in wave 2 from 2022 to 24, and other states were also added. So from 22 states and union territories, the responders were recruited. And the protocol was cognitive assessment, language assessment, geriatric assessment, informant report, food frequency questionnaires, venous blood collection, whole genome sequencing, neuroimaging, pollution monitoring, and environment observation. These are the work which was done in this project. And from the blood plasma was isolated, and these 6 biomarkers were quantified by SIMOA. This is beta amyloid 42, beta amyloid 40, total tau, phosphorylated tau, GFAB, and NFL, which are the biomarkers of dementia, or you can call an Alzheimer's disease. And the instrumental translated into 12 local languages: Hindi, Assamese, Malayalam, Kannada, Urdu, Gujarati, Tamil, Punjabi, Bengali, Marathi, Oriya, and Telugu. And online clinical diagnosis were done, that is CDR analysis was done. And in future, axillometry and life history and ocular imaging will be done. Now this cognitive test, the neurocognitive testing was conducted to measure the different domain of the cognition, like memory, executive functioning, language, orientation, and constructional praxis by Hindi mental state exam, that is the Hindi version of MMSC, HRS-TICS, that is health retirement study telephonic interview for cognitive status, word recall, delayed recall, word list cognition, recognition, digit span forward and backward, symbol cancellation, logic memory, and logical memory delayed was tested. And informant reports were done by from this cognitive test, that is demographic, GRM, IQ code test, CSI, community screening interview, activities, and this food frequency questionnaires, food consumption habit, food frequency, Ayurvedic herbal supplement, and end of life, that is the informal about death, will be done. And then GRM IQ code test. So now the online clinical consensus diagnosis, that is the CDR, was done by the clinician of 3 clinicians, and they have done separately, individually, without seeing others. And all assessments are done. If it is yes, all 3 agreed with that assessment, then it is yes. If it is no, then again that thing was done or, by the to resolve it. And after that, if that is again, if it is yes, then it's okay. If there is any ambiguity between the clinicians, then it goes to the others, 3 expert reviewers for that. And health assessment was done by anthropometry, that is measurement of blood pressure, height, weight, midterm, cuff height, waist circumference measurement, and functional status, ADL, IADL, mobility, fall risk was measured, and mental health like depression, bake, anxiety, inventory. Now, that whole blood, this is anthropometry, functional status, social activities, repeated chair stand, nutrition assessment, audiometry test, and venous blood, which was collected, that is divided into 3 parts. One, that whole blood assays were done, complete blood cell counts, and determination of HbA1c, and then from serum was separated out to determine all these parameters of the responders, and then plasma was separated to determine these markers by SIMOA, all the 6 which I mentioned in the earlier slide. Now the audiometry device, this is a novel addition of hearing data of the LASI-DAD study to Wave 2 generated dataset to bring together high quality cognitive measurement, because this hearing loss is one of the main cause of this cognition. So this device is very helpful for the detection of the hearing loss, which is a portable technology, pure tone audiometry, criterion standard for characterization of hearing loss, represent the peripheral access to sound, bald head categories of hearing loss. Now, MRI was done for the structures and functions of the brain. So these are the partnering sites, that is Institute of Neuroscience in Kolkata, NM Medical Center, Mumbai, AIMS Mangalagiri, Sanjeevani Scanning Solution, Chandigarh, Narula Diagnostic, Gurugram, Haryana, National, NIMHANS, Bangalore, Graphic Era Institute of Medical Science, Dehradun, NIMS University Medical College, Jaipur. So the sample size for wave 1 for MRI was done 137, and wave 2 is 638 responders. We genotyped 960 geographically dispersed LASI-DAD responders using Illumina Infinium Global Screening Array. Polygenic risk scores were constructed for Alzheimer's disease and general cognitive functioning for consenting LASI-DAD respondent who provided whole blood DNA in 2018. And we completed the whole genome sequencing of 2,800 participants from 18 states and union territories of India and deposited the data and quality control report at NIA-GADS in 2022. And methylation, we have conducted the DNA methylation assay for wave 1 and wave 2. Currently, we are analyzing the data. And for the environmental study, the ambient air pollution, we estimated the outdoor PM 2.5, as India is very polluted country. The concentration, source-specific PM 2.5, O3, and NO2, our estimates are at 1 kilometer square resolution and linked to survey data using geographic information. And the indoor pollution, ultrasonic personal aeroscopic samplers are placed participants' home for 24 hours to check the pollution, and data is uploaded to the server to analyze. For CO2 monitors, starting in wave 2, phase 2, we collected CO2 and temperature data from participant homes using an Arena 4 device. Environment observation, a series of 4 photos are taken to access the surrounding environment, which are our lives. GPS coordinates, time, and orientation data are collected from the picture metadata. Information from the photos is extracted to generate environmental indexes such as walkability index using AI and ML approach. LASI-DAD is the first and only nationally representative study in the late life cognition dementia in India. It is the part of NIH Harmonized Cognitive Assessment Protocol and Alzheimer's Disease Sequence Program. The project is funded by NIH, Bright Focus Foundation, and Gate Ventures. These are the members of the LASI-DAD, and these are the institute which are involved in this LASI-DAD project. Thank you. Now, Sandy will give the data from where it will find the data. That is the availability of the data. Thank you.
Hi, everyone. I'm Sandy Chen, Director of Data Management from University of Southern California. Today, I will be showing you the overview of the LASI-DAD data product. I will be highlighting what's available now, tell you more about the upcoming data release, the key data features, most importantly, show you how to access the data. I will also show you how to link the data between different files. LASI-DAD provide 2 types of data, raw and harmonized. The raw data are the dataset from survey study data collection. It maintains the original survey design, including all the ski pattern, response categories, and detailed variable coding. This file was used to construct the harmonized data. The harmonized data is a user-friendly dataset to provide research-ready variables. The variables are standardized across wave and studies. Each dataset combines the variable from all waves. Each individual is represented as one record in the file. Variable has been built to account for the ski pattern, designed to facilitate cross-wave and cross-study comparisons. So what's available now? For the raw data, the 2 waves of raw data are available now. The wave 2 data was released in February this year. The raw data include all sessions from the instrument, including cognition tests, informant reports, and geriatry assessment. In addition, with our Venus blood collection, we prepared 2 blood-based biomarker files. First, the whole blood and serum-based biomarker are available now. The plasma-based neurodegenerative biomarker will be available soon. We also prepare a tracker file. The file provides a key demographic information and interview status, as well as survey retention or attrition status for Wave 2. For example, we provide an indicator to identify whether the respondent died between Wave 1 and Wave 2. We also provide instruments for informant report and geriatric assessment. These are available on our LASI-DAD website. 2 additional documents are available. They are hearing test protocol and blood collection protocol. The harmonized LASI-DAD version B.1 was released in February this year, which included data from both Wave 1 and Wave 2. The dataset includes the following section: demographic, identifiers, and sample weights. Cognitive measures, including the domain-specific feature score, informant reports, clinical diagnosis of dementia in DSM-5, health and physical measure, polygenetic risk score, audiometry assessment data, and blood-based biomarker data. In addition to harmonized and raw data, we also provide genomic and neuroimage data for Wave 1. The genomic data, including the GWAS and whole genome sequencing, are available through the NIGAR, the NIA Genetic Data Repository. Neuroimage data, such as structural MRIs, are hosted at the Image Data Archive, managed by the Laboratory of Neuroimaging at USC. This data can be linked to LASI survey data for integrating analysis of biological and cognitive measures. Looking ahead, we have several new data products in the pipeline. For both Wave 1 and Wave 2, we will include online clinical consensus diagnosis rating and plasma-based neurodegenerative biomarkers. For Wave 2, we will add the full frequency data, micronutrient data, the language assessment, end-of-life PASI report, indoor air pollution data, including temperature and CO2. The link outdoor pollution will be available on the Gateway archive for both Wave 1 and Wave 2. This additional data will greatly expand the scope of research questions that LASI-DAD study can support. Now, I would like to highlight a few key data features. Imputation. Imputation was implemented to address missing data for the cognitive and informant report measure. The impute variable was provided to enhance accuracy and robustness of longitudinal data. We provide the flag variable for each imputed variable, so user can decide whether to use the impute or raw value. Sample weights. Sample weights are provided to adjust for sampling design and non-response, ensuring the LASI-DAD sample align with Indian older population. The sample weights are calculated for subsample with blood-based biomarker data. Summary cognitive measure. The general and domain-specific feature score, like orientation, memory, language, executive functioning, and visual spatial ability are provided. The comprehensive audiometry assessment measures using a validated field-based HearX device. LASI-DAD is one of the few aging studies to implement large-scale hearing tests in the field setting. This approach provides feasible and produce high-quality hearing data for the analysis. Dementia classification. We provide 2 dementia classifications, both DSM-5 and cognition adjudication. DSM-5. We apply the DSM-5 criteria to classify the mild and major neurocognitive disorder. The result align well with social demographic factors and show reasonable agreement with clinical CDR rating. Cognition adjudication. A follow-up process was used when online CDR rating are inconsistent or uncertain. The system flagged the inconsistent case, and the clinician examined the data and reviewed the longitudinal history. This process increased the accuracy of dementia classification. It also added clinical depth to the data-driven rating. This support consistent across wave and rater. Together, these data features support a wide range of research on aging, cognition, dementia in India. Now, I'm going to show you how to access the data. First, you will need to visit the LASI-DAD website, the LASI-DAD.org. Click on the data on the top right corner. It will take you to the data download page. On this page, you will find a brief guide how to access the file. You need to register on the Gateway to Global Aging Data website and sign the data user agreement if you haven't registered. Remember, everything is free of charge. The step-by-step download instruction will guide you how to access and download the data if you have any question. Please visit the g2aging.org and sign up to access the file. Here is the sign-up form look like. Once you register and sign to the G2Aging website, select the harmonized data on the top and get data. It will take you to the data page. You can find the harmonized LASI data under the HCAP table. After clicking the harmonized LASI-DAD link, it will take you to the LASI data download page. This is the LASI-DAD data download page. On this page, you can download the raw data, tracker file, and harmonized LASI-DAD. There's another data file on this page called Dementia Imputation Data in LASI. This data is the data that use LASI-DAD clinical dementia rating to estimate the probability of dementia for each LASI respondent who is age 60 and older, did not participate in LASI-DAD. You can find more information in the data user guide after you download the data package. You can also find the harmonized LASI, the main LASI study, on this download page under the core study table. Similar to harmonized LASI-DAD data, this is also a user-friendly and research-related data file containing the main LASI study core data with more than 73,000 respondents. This national and state representative survey data contain the comprehensive data on the key economic, social, and health measure. You can learn more about the LASI data product by watching the webinar, that previous recorded webinar, on the G2Aging website. Now I'm going to show you how to link the data between LASI and LASI-DAD. Point key is a unique identifier that can be used to link between two files. Here is an example of data code to merge and subset the data. First, you will read in the LASI-DAD data, use the merge function to merge both files and keep the variable you need to use using the keep using statement. In this example, we are keeping the health measure like the ever been diagnosis with hypertension and diabetes variables. And you can use the key if statement to select the LASI-DAD sample only. We have two upcoming webinars. On June 5th, Dr. Pernari will present the cognitive assessment, and Eldon Gross will present the latent factor scores. On July 10th, Dr. Joita will present the informant report, and Marco Agostini will present the dementia caregiving in LASI-DAD. If you have any question, you can send us an email at help@lasidad.org. Thank you.
Thank you very much, Sandy and Dr. Sharmista. I think we ran through our slide deck very quickly, so I think we do have enough time to answer any potential questions the webinar participants may have. So is there any questions from the participants that we can answer? I have seen on the Q&A that whether the slide deck will be available. It would be available right after this webinar on our project website, LASI-DAD.org. And so as Sandy has shown you, all the data and related document will be available there. You can also find out the papers that came out earlier from the both wave 1 and wave 2 data, and all of that citation of various data and publication will be also available. So I see another question about the whole genome sequencing data. So whole genome sequencing data is available from the NIAGAD's website. So if you can just go through the NIAGAD's application package, anybody who's interested in whole genome sequencing data will have an access. So the website, maybe Sandy, you can type the website, NIAGAD's website on the chat button. I think that will be very good. And we have another question about specific data comments for the using rates. I think Sandy and Tristan, you have included that comment in the slide.
I will share the comment in the comment. So
next question is about the can we get help from the statistician for LASI data analysis from our side? Unfortunately, not. I don't think we have a capacity to provide the statistical support at this point. And it's not from current projects. I don't think we have enough capacity to provide such support. The next question is about the cognition questions, whether cognition question is adjusted for the literacy and linguistics. The answer is yes. We have conducted a series of pre-tests going through making all our cognitive tests is suitable for the population that are illiterate and innumerate. And we have conducted all the cognitive tests in 13 different languages, including 12 local languages. And when we developed the instrument, we went through both forward and backward translation. So yes, both of those issues we have taken very seriously and addressed them. And our next webinar, Dr. Panali Cobright will introduce various cognitive tests that we have conducted in greater detail. And Dr. Arden Gross will also introduce the latent cognitive scores that he has constructed using item response theory, and also address that when he has looking into various cognitive test performance, how it is validated and present the valid cognitive scores for both illiterate and innumerate populations. Okay, and the next question is about can you share some more resources from which we can learn more about DAD from socioeconomic perspective? So for that question, we like to encourage all our researchers to link our LASI-DAD data to parent LASI data. LASI-DAD study is developed using the same sample from main LASI study. Longitudinal aging study in India is nationally representative longitudinal study that has very rich information about socioeconomic data. So as Sandy has shown you, you can actually link LASI-DAD data to the main LASI data. And by doing so, you can actually looking into various association between socioeconomic factors into the LASI-DAD data. The next question is about will we get support in using this data better? So I would like to encourage you to send us a question if there is any questions you may have through our the website support help email as Sandy showing you. So if you can send us questions through the email, then we'll try to answer the questions as quickly as possible. And also we are planning to have this series of webinar and introducing both the content of the data more as we move forward. And then you can, just like today, right, provide asking any questions you may have as we introduce greater details of the data as this webinar series continues. Right. And the next question is about specific data commands for using WAIS. And we have our programming team, Sandy and Tristan will share those specific data command for that. And the following question is, what WAIS do we need to use when merging, if any? So in order to merge the data, Sandy has already shown you actually the command for merging various data sources. So I'd like to encourage you to take a look at the slide deck, and we will put out this slide deck right after this webinar, so you can go back to use those commands. Second question is, are the LASI-DAD nationally representative? And the answer is yes. LASI-DAD is a nationally representative study. It is because we utilize main LASI sampling frame, and we developed a sampling frame that randomly selecting our LASI-DAD respondents from main LASI respondents. We has taken stratified sampling approaches, so we will cut across 22 different states within India, and within those states, recruited the samples randomly to obtain that national representation. It is very important to have the inference, make national inferences. So our sample is representative, representing 97% of the population. The next question is how we can contact. I think we will put our help email addresses so people can reach out with the questions. What is the difference between harmonized LASI version 2 and version 3? Thank you, Tristan. Tristan is going to answer the specific details between the differences around these two different versions. So what we are doing is actually we update our data files as we move forward. As Sandy mentioned, we make additional data available, and when we do that, we actually provide greater details of what are the new data and what is the modification that we have made. Tristan, do you want to chime in here?
I think Sandy is probably better to answer that question.
Sure.
So for the LASI 8 the difference between 8.2 and 8.3 is we add the additional state that interview happen later. So I think we have one state is interview in the 2021 or 2022. So that's the additional state was added to the data file. That's the main difference. And then, but more detail in the codebook, we specifically say what's new session. Just at the beginning of a codebook, you can see all the detail. What's the new addition to the 8.3?
Thank you, Sandy. The next question is about can researchers who are not part of LASI-DAD analysis and publish the LASI-DAD data? Of course, this is a public data, so we invite all of you to use our data. I think it will be terrific, and there is so much we can do, our small investigative team, so I'd like to really invite all of you who are interested in our data to take use of it. We are not asking for any authorship. Anybody can just use the data and analyze them and publish them. I think it would be terrific to please provide the citation, especially as Dr. Sharmisa mentioned, that this project is funded by National Institute on Aging, and acknowledging that that support is very important for us to continue seek the grants. So we do actually ask for those citations. When you download the data, we actually ask you to acknowledge such a statement. So I'd like to ask you to pay attention to those requests and include those funding acknowledgement in your papers. But beyond that, we are not asking for anything. Please use the data and encourage your students and your colleagues to use our data set. Next question is, will you have any details on nutritional status, protein malnutrition in particular, and cognitive status? Yes. Actually, Sandy and our data team is working very hard right now trying to release our data on food frequency questionnaire. So we collected and we developed the food frequency questionnaire and collected the diet data, and first time in India. And our diet team has also converted that food frequency data into the micronutrient data files. So we plan to release that data very soon. And with that data, I think a lot of interesting research projects can be done. So I would like to invite you to just register as our gateway users. We will send you an announcement when the data gets released, and you will of course be able to use both in terms of the frequency of various food consumptions, as well as the estimated micronutrient consumption. And our diet team consists of Dr. Alka Mohan, Dr. Alka, I'm blanking on, and also Dr. Joita has worked very closely on developing those. So I like to get data to be used widely. The next question is about the access to the low MRI images. Is it through the USC website? Yes, it is through our USC website. It is called managed by ADNI because these are the large data file. So all our neuroimaging data is managed by the ADNI team. And again, anybody who's interested in data will have an access to the data. So just fill up the user agreements and submit the paperwork, then you will have an access to that. What is the total number of respondents in this data set? So for wave 2, we have 4,635 respondents. Wave 1, we have 4,096 respondents. So we followed up wave 1 respondents over time, but we also brought in additional refresher sample to the second wave. So we have a slightly more number of respondents in our data set. Is any provision of postdoc position in this project? Unfortunately not. We are actually seeking funding and hope we can, have such a position in the future. But at this point, we don't have any open position. The next question is about, are there direct questions in LASI-DAD to know prevalence of dementia? No, we do not have any direct questions in such question. In dementia. That's because dementia is quite underdiagnosed in most of the settings. Many people, when there is experience cognitive impairment, they consider that as part of aging. In other settings, access to healthcare is limited in many places. So I don't think we can actually trust, even if we ask that single question, the validity of the answer may not be that high. So we do not have the direct question. Or there are any same data being collected for spouses in LASI-DAD dataset as well? No, we do not recruit the spouse of the respondents. Can we find this data in any government portal in India? No, we have not received any funding from government of India. So I don't think government of India will provide this data on their portal. The next question is, what is the weight variable in LASI-DAD? We need to use them when merging data. I think somehow this question came back again. We make this comment and the weight variable specified in Sandy's slide deck. So please make a reference to that.
Also,
Is less...
I can jump in. They're also provided as part of the code book. So there's in the introduction to the code book, there's examples of what variables to use and how to call those weights in Stata.
Yeah, thank you, Tristan. All right. The next question is LASI being carried out in all states of India? Yes, main LASI is being carried out in all states of India. LASI-DAD study has been carried out in 22 states of India, not all states. Okay, the next question. Any guidebook with this data code on how to use this data better? So as Tristan mentioned, we do have a code book available together with the main data set. So we'd like to invite you to review the code book carefully. That really provides the details about which way to use, as well as how we coded the data. I think especially in working with the cognition data, it is very important to think about when people refused it or they said they don't know. So those kind of details of how cognitive test answers were coded and they're presented in the data set is important details. So I think a lot of times users do not read codebook carefully enough, I think. So I like to really encourage people to pay a lot of attention to those details of the codebook that we put out. Why only India choose about LASI, not other South Asian country? So the answer to that is I love India. So I worked on the India project with Dr. Sharmista. So this project is all about India. But I like to also inform you that there are other efforts in larger HCAP, which is Harmonized Cognitive Assessment Protocol, has been implemented in other parts of the Asian countries as well. So China has conducted a similar study. I know there is an initiative that currently going on in countries like Nepal and also Pakistan. I'm working with the colleagues in Bangladesh, so we are hoping to get started in Bangladesh. I know there is a study team in Sri Lanka who's planning to also start a study. So I think there are a lot of studies in Asia who with a great interest in late life cognition and dementia. So you will see more data coming out in this part of the world as we move forward. Okay, the next question is about, is there any assessment of psychological variables in relations to dementia? So in terms of psychological variables, we administered the questions on depression and anxiety. And we use DEX, anxiety, battery, and CSD. So those data are available in both wave 1 and wave 2 LASI-DAD data. Was data included any or many Himalayan states of India? So main LASI includes that, but LASI-DAD is more limited. So we have done the field work in Jammu and Kashmir. So we have some of those states in our data set. And we do provide information which state the respondents reside. So you can actually look into the data and identify the, what proportion of our data collection was done in those states. Can you talk about policies where they are available? I'm not quite sure about these questions about the policies. So aside from the main LASI-DAD project, actually this webinar is organized in partnership with our Gateway to Global Aging Data project. Gateway project has a policy initiative, and we've been collecting India state level policy data in education and long-term care policies. So that work is undergoing, and once that's done, we are hoping to make those linkages to linking state-level policies on education and long-term care to our respondent level. So one can explore the policy variations within India and how they may have influences on cognition outcomes.
Also, just jump in. We also have COVID policies at the state level in India, and those are available on the Gateway website currently at the state level for India.
Yeah, thank you, Tristan. I think that's a very good point. Actually, we have done a COVID phone survey as well. So our COVID phone survey data are available on the website as well. Next question is, are there any papers or documentations to understand how cognition questions are chosen, both LASI-DAD and LASI-Core-Wave? And we have published our papers on both addressing these questions. So our methodology paper, actually the first authored by Dr. Joyita Banerjee, talks a lot about the selection of and development of our cognitive battery. So I like to make a reference to that paper. So if you can come to our LASI-DAD project website and click to our publications page, you can identify the paper that I'm making a reference right now. For core LASI data cognition, we have published the paper using that data. Actually, I think I saw Urvashi on the participant list, and that paper, the first authored by Dr. Urvashi. And I'd like to invite you to look at the paper that she led. And in that paper, we introduced a much greater detail on how we chose the cognition test for the main LASI data. Oh my God, I answered all the questions. All right. If there is any other questions, I'd like to invite Dr. Sharmisa. Any last words, Dr. Sharmisa?
Thank you all for attending and taking interest to our project. So I think Professor Lee has answered all your queries and questions. If you have any more, you can send an email to us. And we are we'll be happy to give answer of all your questions. Thank you so much.
Thank you very much, Dr. Sharmis, and thank you all for coming, and thank you, Sandy, for preparing today's talk, and all the work that you and your team did to make preparing the data and releasing that to the public in a very, very short time frame. So our team is very proud that we released this data as quickly as possible, because we want this data to be used by the larger research community. So please use our data, and I hope to see a lot of exciting new science coming out from the larger research community. And I want to thank finally, National Institute on Aging. I think without that funding and the support, none of this would be possible. So my sincere thanks to our funding agencies, and I look forward to continue working on this project and wanted to see more science coming out. So thank you all, and we will see you guys in a month, and we'll tell you a lot more details about the cognitive test battery and our important outcomes. Thank you all.
Thank you.